everyone, I'm Kuforola Eboluwa, and I'll be taking us on the course Introduction to Theoretical Development and Nursing Model. The course code is NSC 311. Now, what is a theory? A theory is defined as a set of concepts, definitions, relationships, and assumptions that tell us what a phenomenon is, that tries to explain what a phenomenon is. And that theory is a notion or idea that explains an experience, that interprets the observation, it describes relationship, and it projects outcomes. An example of a theory is the theory of gravity. You could see that with the theory of, if you look at the history of the theory of gravity, it was based on someone's experience who realized that for every time he throws something up, it would definitely come down. It will not stay up. And over time, because of that experience, he looked at his observations, he described the relationship that there is a force that is acting on whatever it is that is thrown up. And because of that, he has been able to project an outcome that once something goes up, it will definitely come down. And so, nursing theories describe and relate the different aspects of nursing and gives framework for systemizing nursing practice. So, why do we need theories in nursing? It helps us to understand the complexities of reality for both practice and research. The nursing. So there are different terminologies related to nursing theories. And one of these terminologies are paradigms. Now, paradigms are models which explain how science, philosophy, and theory are connected and accepted and applied by the discipline. Now, in this context, the discipline is nursing. So, paradigms in nursing show how the science aspect of nursing, the philosophical aspect of nursing, that is how we think, how we reason, how our logical thoughts, our world view of how we see things in nursing. The more we go on in this course, the more we will understand what these things are. So it shows the relationship between science, philosophy, and the theories that we have in nursing, how they are accepted and how they are used within nursing as a discipline. Then concepts, are different ideas and notions that can be used to describe a phenomenon. For instance, if you are talking about a phenomenon like transcultural nursing, one of the concepts that you find in transcultural nursing is culture. So culture definitely is one of the key things, key ideas, key notions that you use to describe transcultural nursing, because it means providing care that is culturally acceptable. For you to understand how to provide culturally acceptable care, then you have to have an idea or a notion like culture, which will describe what you really need to do. Then a conceptual framework are a group of concepts that are defined and scientifically ordered to give a justification and can be an instrument for the integration and understanding of various concepts in that phenomenon or in nursing. Then a phenomenon is a situation or a reality that can be measured or observed. So maybe you have observed that there is need for you to be able to provide a psychological aspect of nursing care, which is a phenomenon that can be measured or observed. Over time, you carry out research. What are the psychological needs of a patient? And when you identify the psychological needs of the patient, you can bring this together to be able to use it to form a theory. And assumptions are explanations of concepts, like the definitions of concepts. What do these concepts mean in the context of this theory? So, the other time I told us about paradigm. Now, nursing has a meta-paradigm. This is a framework encompassing the four essential concepts which shape nursing practice. So when you see a typical nursing theory, it has these four essential concepts defined in the context of that theory. So there are four of them. The first one is the person, and the person is our patient or the client who is receiving care from the nurse. So the patient is seen in the aspects of in their physical, emotional, social, and spiritual dimensions. Now, the second concept is the environment, which encompasses all the external factors affecting this person, such as the physical surroundings, the social conditions, cultural influences, and significant others. Then health represents the overall well-being of the person, including physical, mental, and social health, while nursing involves all the actions that the nurse carries out in providing care using knowledge, skills, and attitudes that are appropriate to provide that care. And nursing meta paradigms, are usually defined based on whatever it is that the theory is. So you can't find the same definition of a person in all the nursing theories. No, the nursing theory would define a person or the environment or health or nursing based on what the theory is focusing on, based on the phenomenon that the theory is focusing on. So there are different types of nursing theories. The first is the grand nursing theory. And the grand nursing theory is the very expensive kind of theory. It can be used in many situations. They are not tailored to a particular situation. They are not tailored to only community health nursing or medical surgical nursing or maternal and child health nursing. No, you can use it cuts across all aspects of nursing. Then middle range nursing theories, they don't have a wide range as grand nursing theories. What they do is they address precise observable facts and they replicate practice. So they are more tailored towards very practical ideologies. They are more tailored towards practice. Meanwhile, grand nursing theories can be used in practice, in administration, in research, in nursing education, but middle range theories are more tended towards practice. Now, prescriptive slash practice level theories will suggest what intervention you as a nurse can use on the patient and the possible effects on that patient. Now, prescriptive, they are suggestive in nature. They prescribe, they give suggestions, they give ideas, and they are tended mostly towards practice, not just nursing education or nursing administration. They are tended more for practice. And then descriptive nursing theories, what they do is they describe a phenomenon, an event, or a situation. But of the four of them, the one that is the most popular are the grand nursing theories, and they are generally the oldest form of nursing theories that we have. So now there are some popular nursing theories and their theories. Of course, the mother of modern day nursing, Florence Nightingale, has a theory, and her theory is environmental theory. Then Virginia Anderson, who gave us that very popular um, definition of nursing, has a theory which is the 14 components of basic nursing care. Then we have Betty Newman's system theory, Dorothea Oren's self-care deficit theory, Sister Calista Roy's adaptation theory, Jen Watts' theory of caring. All these theories that I've mentioned, they are grand. So, what are the uses of nursing theories in nursing education? It is useful for use of curriculum development because it's based on research. So it provides a framework for designing curricula that is appropriate for nursing. So when you look at all the different nursing theories and you say, okay, all these nursing theories have shown the different aspects of care that are important for the patient. Like when you look at the environmental theory, you look at the 14 essential needs of the patient, you look at the transcultural aspect of nursing care, you look at relationship between people, which is a theory by Heidegger Peplau, and you use all these different components to develop an appropriate curriculum for nursing students to be able to train them on the kind of care that they should give to patients. You can see the importance of nursing theories in nursing education. Another importance is teaching methodologies. It helps to guide the selection of teaching methods that promote critical thinking, problem solving, and clinical reasoning. One of the ways to teach students is not always by being in the classroom. It could be, when you see an interesting case on the ward, inviting the students to come and see that case. Part of also teaching is when students go on ward posting, they participate in activities on the ward, and through that they are building their psychomotor skills, and then it's helping to ensure that what they have learned in class has stuck. Some of these teaching methodologies have been developed based on research. Then theories help in developing assessment tools that evaluates students' understanding of concepts and their ability to apply them to practice. So over time, theories have shown that, oh, okay, if you use maybe the traditional method that we used to use before for nursing examinations may not be objective enough to be able to give you, a very good idea of how good that student has done in his or her, clinical work. And that's what brought about the use of OSCE. It is research and theories that have brought about that. And you will see that, after you've done your written exams in the school, you now do an objective structured clinical examination, which is based on theory. So, everybody is exposed to the same set of questions within the same period of time to be able to get a very objective score or a very objective evaluation. Now, why are theories important, or how are they used in nursing practice? They are used to take clinical decisions, and they use it to make informed decisions about the patient care based on evidence and ethical principles. For instance, you want to decide what are the specific needs that this patient really needs, or how do we go about ensuring that this patient receives the best possible care, which is part of what brought about the nursing process. Nursing process is based on the theory. So the nursing process has the different steps. You assess, and then you make a diagnosis. When you make a nursing diagnosis, that's a clinical decision. So the theories will help you to be able to make a clinical decision. It also helps to determine, or teach you how to provide patient-centered care by understanding the patient's unique needs and preferences. So theories like transcultural nursing theory, end of life nursing care theory, all these theories focus mostly on the patient's specific needs, not just general needs, but they teach you how to identify those specific needs that the patient has brought to the hospital to be able to get good quality patient-centered care. Then it is also necessary for interprofessional collaboration. It helps to promote effective communication and collaboration among healthcare professionals to improve patient outcomes, because the theories will help to guide on how to elicit information from the patient on the kind of care that they will want to have. And then we as nurses, as patient advocates, will be able to now discuss with other healthcare professionals to be able to meet that patient's needs. How do we use why are nursing theories used in nursing administration? So what are the uses of nursing theories in nursing administration? The first is for organizational development. It helps to guide how organizational structures and processes are developed that support quality patient care and employee satisfaction. If the nurse is not comfortable with the hospital, it will be difficult, for her to also provide adequate patient care. So there are some theories that, even though they were prepared mostly for patients, they can also be applied to the nurses. An example is Kokava's theory of comfort. Then leadership styles. It offers insight into different leadership styles and their effectiveness in various concepts. And then quality improvement. It provides a framework for implementing quality improvement initiatives and evaluating the impact of these initiatives. So we can see conclusively that nursing theories provide a solid foundation for understanding and improving nursing practice by guiding decision making, shaping nurse-patient relationships, and contributing to the advancement of the nursing profession by being part of the knowledge base of the profession. And nursing theories are not just academic knowledge. They are tools that can empower nurses to provide high quality and patient-centered care. So nursing theory should not just it should not just be our focus in the academic area. The nurses who are in the clinical area too should always reappraise themselves about theories, the different kind of theories that are available, and how they can use them in the clinical area. If you have any questions, please put them in the comment section, and then I will answer them as soon as possible. Thank you very much for listening, and I look forward to seeing you in our next class. Bye.